Hi, everyone. We're just going to start in a couple of minutes. We'll just let everyone roll in. We're just going to wait for 1 minute and then we're going to get started. All right, everyone. Thanks for joining me today. We wanted to kick off this webinar week with a series of different topics done by different professionals that work with us here at Kawartha Care. So you're going to be seeing a different topic presented every single day this week, Monday through Friday, and possibly into next week as well. And you can register for any of these on our social media, or at the end of this presentation, you can touch base with us and we can register you as well. So let's kick it off right away and let's talk about a topic that is so concerning to us right now, and that is ergonomics. I'm your host today, Dr. Asdhir, here at Kawartha Care Wellness Center, and I'm super, super excited to talk about this because it's something that we've been sort of agonizing over for the last 6, 7, and possibly even 8 weeks now. Ergonomics, 5 easy changes to make to your home office. So one thing that I've realized, and the number of calls we've gotten is crazy over this last, again, 7 to 8 weeks. The pandemic has sort of tossed us into a work at home environment, which we were not ready for. None of us really. That means that we're now working from our dining tables. I've tried that. We're working from our kitchen counters. We're also working from, I hate to say it, our sofas and even our beds. And again, those are not the best places at this point, as I'm sure many of you have realized. So ergonomics has always been a really, really, really important topic, but now it's just pushed it to that next level. It's more important than ever because we have to be really realistic about what we have at home and what we can use versus what we had at our office. We may not have those conveniences like a really nice ergonomic setup, such as a really nice chair, a nice footrest, keyboard, so on and so forth, but that should not deter us from still having our workspace set up appropriately with what we have. And that's what I'm here to teach you. So we're gonna break it down. We're gonna make it super easy. And the bonus of all this is you probably will either spend $0 or at a maximum $30, if at all, to change your entire workspace to avoid any sort of pain. So let's get started. If you do have any questions, if you want to click to the bottom of your screen, what you'll see is a Q&A bar, and you'll also see a chat. And so you can either click on either one of those. If you want the Q&As, we'll answer those at the end of the presentation. And if not, and you wanted to chat throughout and you have questions throughout, again, I'll answer them at the end of the presentation. But if you click on all attendees and panelists, everyone will be able to see those questions, and it may be helpful to other people as well. So we're going to get started now. The agenda for today is a couple of topics. What is ergonomics? Space for your mind and body at home. Poor versus good ergonomic injuries. 5 ways, 5, to love working from home. 3 easy stretches. And at the end, a virtual ergonomic assessment if you'd like. So here we go. 61% of Canadian employees are said to be burnt out on the job. Again, this is a Canadian statistic. So 61%, can you imagine? Those are 6 out of 10 people that you work with are burnt out on the job. And 39% of these employees attribute this to the pain that they feel due to the job. Many of these pain factors can be mitigated if you do have a proper ergonomic setup. And again, it can be as easy as what we do today. So the pain that they are experiencing because of these poor ergonomics are things like jaw pain, neck pain, shoulder pain, low back pain, even a resurgence of carpal tunnel if they've ever had that before as well. Ultimately, this is decreasing productivity in the workplace and, of course, increasing stress. So it's definitely not a win-win. So when we look at risk factors for muscle pain in the workplace, there's 3 risk factors. There's force on the muscle, repetition, so how often you're using this muscle, and of course, your posture. Everyone's workspace is going to look slightly different, and we recognize that as practitioners. But what I usually like to follow is the 80-20 rule, and this can apply to so many different scenarios. But essentially what you want to do is you want to break down your week or even your day 80-20. So what do you do in your workspace 80% of your day or 80% of your week? That's where you really want to target. So, for example, if somebody is, has multi-screens and they're sort of turning their head and they're going to be at their workspace 8 hours a day, that is more something that we look at in terms of like what they're doing while they're in their chair, their footrest, all that kind of thing. Whereas somebody who's working in the factory line, that might look very different. And then also somebody who's on the phone 80% of the day. Now that, again, maybe just a headrest. So all these things are very different, and everyone's work environment is different. But what you really want to focus on so you don't get overwhelmed throughout this presentation, and just, later when you decide what to do to make changes to the home or work environment, is just look at the 80-20 rule. What do you do 80% of your day or your week in your workspace? That 80% is probably contributing to a large portion of your muscle pain. So how do we control that? First, we have to identify those factors. So by looking at that 80%, you are identifying and hopefully being able to sort of focus in on what's causing that problem or the area of pain. Number 2 is you want to sort of remove those ergonomic risk factors. And again, this can be as easy as some of the things that we show you today. Ultimately, when you're identifying that and you're removing the ergonomic risk factors, you're preventing any future sort of muscular injuries or any current ones that you're experiencing right now. So we had a lot of people call in with a lot of new injuries to the office because we are still taking urgent care patients, new patients, as well as our patients we've seen before, or emergency patients. So patients who really are feeling awful, they're taking a lot of Tylenol or Advil, and their next step would be to emerge. So that's sort of what we look at as sort of an emergency or urgent chiropractic or physiotherapy patient. And a lot of these people, when we screen them on the phone, we'll ask them, like, are you working from home? And what does your workspace look like? And this is almost what they describe. So the only difference is they're usually in their PJs. But besides that, workspaces at home can vary. If you look to the left of your screen, somebody who's probably on virtual calls a lot, their laptop's hanging halfway off their bed, their notes are on one side, their eyes are looking down when they really shouldn't be. they're really not set up for a lot of success. If you look at somebody on the right, so that lady on the right, she's making do with a coffee table as her office. And you know what? Maybe that's all she has. But even that's something that we can change easily. So she has her laptop in front of her, her phone, maybe she's using her phone 80% of the day. So, you know, getting that kink in her neck, and her agenda's on the floor. So again, both of these are not the best workspaces and definitely something that we can change. The main thing to focus on here, and a good takeaway from this presentation, is that you want to definitely create a home office space that's good for your mind and for your body. We have a lot of people say, you know, I'm working here on this space or this space, and, you know, and now we're kind of seeing a lot of people, because of the social isolation and the quarantine, you know, they're not seeing their friends or family. They're not able to necessarily get that social outing that gets them away from work. So the whole idea behind this is you have to make sure that if you're ergonomically set up and you're not experiencing pain and you're feeling good, then generally your mental health is going to be good too. At this point, again, we're not able to see our practitioners, our regular chiropractors, physios, even myself, I'm not able to do that to get my adjustments in there. So I have to really make sure that I'm doing everything I can in my home office to mitigate the pain and feel good. And so then I can mentally feel good as well, because they do go hand in hand. Our mental health is affected by our physical, and our physical, again, by our mental. So it's a long list of things when we do have poor ergonomics, and I'll quickly go through this because some of you unfortunately might be already feeling these or you're aware of this. So poor ergonomics at home can lead to things like headaches, jaw pain or TMJ, carpal tunnel, low back pain, tendinitis, trigger finger, and ultimately a lot of stress on the body that the body may not be used to. Good ergonomics, alternatively, will obviously lead to increased productivity, better mental health, decreased injury, decreased sick days, and ultimately decreased pain, which again, all things that we can focus on today. So we'll get into the good part, the good stuff right away. And I know that's what you guys are here for. So there's 5 easy ways that I promised you that we could change our home office and fix it up and feel good. And we're going to get right to that right now. So if you look at the list to the right, I'm going to explain it and we're going to go through some pictures as well. But it's the 20-20-20 that will be your best friend after this. Number 2, elbows and wrists that we'll focus on. Number 3, elevate. Number 4, towel up. Number 5, zoom and walk at lunge. So I'm going to give you a couple seconds. If you do want to grab a towel, you can do that, whatever you have around. Nothing fancy at all, just a medium-sized towel or large, whatever you do have lying around is great. And that will be great when we do our demonstration for number 4, towel up. Remember, these are easy fixes. You can do them with me today. You can do them while we're talking through this webinar. And if there's questions, you can always ask me towards the end and just sort of leave them in the Q&A as well. All right, so I'm guessing that most of you guys got your towels. If not, you can go run and grab those a little bit later. Now, if you do these 5 things, you're gonna be better off than most people at this point that are working from home in a sort of desk environment. And again, we'll send this all to you once the webinar is done, so there's no need to memorize or take notes or anything at this point. So what's 20-20-20? So I promised you that if you would be able to remember this one, then you'll definitely love me because it's the best piece of advice I can give you. So 20-20-20. What that means, you work for 20 minutes and focus, then you take a 20-second break and look 20 feet away. So again, work for 20 minutes, take a 20-second break and look 20 feet away. That 20-second break to look 20 feet away will also decrease the digital strain on your eyes and also let your body move around a little bit. So if you're actually getting up to look away, you know, your body is reshifting, your posture is reshifting, the muscles are getting a little bit of a break. And that's sort of my favorite one. So remember, 20, 20, 20, 20 minutes to focus, 20 minutes to break, and then 20 feet away. And remember, like me, you get right into your work, 20 minutes just whizzes by. So you want to use your phone as a timer. That's always a good one. You can do a Siri reminder. You can use your iWatch, whatever you have in front of you, just, you know, use it to your best. So that's our first of the 5 easy fixes. Number 2, 90 degrees. So this one is a pretty awesome one as well. When you're sitting at your home office, what you ideally want to do is you want your posture to be erect, so straight, your elbows and palms to be a certain way, and your feet flat. It's hard to remember to do all that, and it's quite honestly hard to retrain your body and the muscles after many years of not doing that. So here's the trick. If you're sitting at your chair right now, and I'm going to pull this forward a little bit, what you want to do is you want, if this is your desk, you want your elbows, so you can see the chair is a little bit higher for me, but you want your elbows to be at 90 like this, so the 90-degree angle, and your palms to be flat onto your keyboard or table. Now, if you're doing sort of this or this motion, a flexion or extension, in order to get to your keyboard, you're cheating. So you want to make sure, again, you're at 90. Your wrists and your hands are at your table as such on your keyboard, okay? And naturally what will happen, which is the neat thing, is that your posture will also straighten up because your elbows are where they're supposed to be. And you want to keep your feet flat. So that is, again, naturally going to happen. So again, keeping everything at 90, not shrugging your shoulders, not bringing them down and depressing them, but just keeping them normal and keeping your elbows at 90. And if you do that, the posture and the feet will naturally sit where they're supposed to. And the second part to this, so the first part is just the 90, the second part is you want to be able to keep one arm's distance between you and the screen. So you can try that with me right now. So extend out your arm and making sure your elbow is locked, so completely straight. Are you able to touch your screen? If you are able to touch your screen without bending your elbow, you're at a really good distance from the screen. If your elbow is bent and then you're able to touch the screen, you're likely too close to the screen, and so you're coming into a forward flexed position, tightening these muscles, hurting your shoulders as well, and then straining your eyes, looking too close when you don't really need to. If you're too far, like I am right now and demonstrating that, and not able to touch your screen, then what's going to be happening is that, again, you're straining those eyes and you're just too far, and basically eventually you're going to creep forward into like a Smithers type of position, and that's what you want to avoid. So Smithers is from The Simpsons. I'm a new Simpsons fan, so this is a new reference for me, but yes, so just sort of this sort of positioning. So you want to just make sure, again, you are just touching that screen, your elbow is locked, it's straight, and then while you're typing, you want to be at 90. So this is what it looks like. On the left, that is incorrect. You can see that this person on the left-hand side, you can see that nothing's at 90 and their body is creeping forward, so their neck is coming forward, and they're going to be hurting those muscles in here and their shoulders as well and their wrists. Whereas the person on the right is sitting perfectly because their elbow joint is, you know, maybe like 92, you can say, but about 90 degrees. The wrists are flat. And then of course, their feet are flat on the floor, and they are that one arm distance away from the screen. So that's fantastic. And you can do that right now and test. So remember 20, 20, 20, and then of course 90 degrees as well as monitor distance. Okay, so we're at number 3, elevate. Now this is a fun one. I know all of you are probably like me and have tons of Amazon boxes coming to your door because you've been doing a lot of online shopping. And so instead of throwing those boxes away, my suggestion to you is to actually use them and elevate your screen. So I'm going to show you, because I just got rid of my Amazon boxes. But basically something like even a textbook, a yoga block if you have that, you just want to tuck that under your screen so that you're nice, whoops, and elevated. Okay, so essentially what that means is that you want to line up the top of your eyebrows right in here with the top of your monitor, using an Amazon box, a yoga block, whatever you have at home. Nothing fancy at all. If you're looking at multiple screens and shifting your gaze, what you also want to remember is that all of those screens should be lined up as well. So you're not looking down for one and looking up for another. They should all be at level. Now, many of you will ask me, well, how can I do that if you want me to keep my wrists straight onto the table? And that's where that cheapy sort of small amount that you might have to spend, a portable keyboard would be great for that, and that will really help the wrists and will also help you elevate your laptop as well. So the number 4, so we're almost there, so far so good hopefully, is towel up. So we talked a little bit about how we're going to use this as a dual purpose. So first of all, low back support. Let's talk about that. Now, low back pain, and this is a webinar we're actually doing with Eric on Wednesday, so you can sign up for that if that's something that you're experiencing right now, and that's free as well. All the webinars are free this week. So when you have yourself at your home office, your work office, you might have a nice obus form or back support for that low back curvature that you naturally have. But at home, like myself, I don't have that. So I use a towel. So just, you're gonna roll up your towel like I did here, okay? And what you're gonna do is you're just gonna tuck it in to that curve in the back and just rest on it. And that's really gonna help you because it's gonna give you some extra support in your lower back. It feels really good, and we're gonna use it for a different purpose as well later, but it's just that extra support when you don't really have that at home. The nice thing about this as well is if you attack that low back and sort of cushion it properly and support it properly, then you're probably going to, again, decrease the likelihood of having things refer down the legs as well, like sciatic pain, or any sort of symptoms or aches or pains down the legs as well, because you're really supporting that low back. A lot of our dining chairs are too soft, they're too cushiony. You know, if you're using your sofa, same thing, it's a little too soft and cushiony. So you really wanna have some support at that low back area with a simple towel. All right, my last one. So we always talk about mental health. That's a big component, especially right now, with the lack of socialization for everyone. So what I recommend for most people is, again, you want to get up, you want to get moving, but maybe you're not in your usual exercise routine, and you know, you kind of lose track of time, and you know, the 8 hours of your day just keeps going on and on. So what you want to do is you want to incorporate our Zoom and walk, and it could be a FaceTime and walk, it could be a, you know, a web CT and walk, whatever media you normally use. But essentially what that is you're ensuring you have some socialization to your work environment, so your work at home environment. So at lunch, have your lunch, enjoy it, and then take about 15-30 minutes, whatever you have, and walk around your home or take a walk outside with your phone and talk to a colleague from work or a friend or a family. You just want to have some sort of social contact throughout your workday, even if it's for a short while. And you also want to get your body up and moving. So you're not necessarily eating at your table that you're working at, and you're just getting those muscles going again, and the blood flow kind of work into. Okay, so just walk it out. So we're going to summarize all these. And I'm just going to go to the next slide. So let's review. So number one, 20-20-20, which we said 20 minutes of work, 20-second break, and 20 feet away to reduce digital strain and get your body moving. You could also do those stretches that I'm going to talk about within those 20 seconds as well. 90 degrees with your elbow, making sure your wrist is flat, similar to the diagram on the right, and making sure your monitor is 1 arm length away. Elevate. So you might not have the apparatus that's shown here, but again, your Amazon boxes, which are, you can explain to your hubby that they have dual purpose. When you're shopping, you can use a yoga block, or you can even use, and I kind of date myself when I say this, but like a Yellow Pages or something, or a textbook. Towel up, so that's sort of incorporating your towel and your low back curve and letting your curve just rest in there. And again, reducing the likelihood of things, of pain down the legs, like sciatic pain, for example. And the last thing is we want to incorporate mental health, as well as, just moving around with the body and getting good circulation. And we say zoom and walk, or just take a nice social break in the middle of your day. So we're going to skip back now. Now we looked at the 5 things that we want to change, but we want to make sure that we're also moving our body appropriately. And we want to do that by doing some simple stretches that we can do during our 20 seconds before or even after work or throughout. And these are the best ones and probably the easiest ones that you can incorporate. So we already talked about keeping your palms and your elbows at 90 degrees, so right in here. So this is something you can do. You're going to get tightness throughout the forearm area. Even your wrist, even if it's flat, it can get tight, especially if you're typing a lot. So what you want to do is you want to lift your palms up so they're looking at the sky. Okay, so palms up. I'm just going to put it like that. And then what you want to do is you want to squeeze the wing bones, scapula, or for women, it's where that bra strap line is. You just want to squeeze those muscles back, lifting your palms up. It feels pretty awesome, a nice stretch, and it's also forcing a little bit of release in those muscles. So you want to do this a couple of times. You don't have to hold it for very long, maybe 5-10 seconds at most, and a couple times should be suffice, and you'll feel that nice stretch. So that's called palms up. Wringing out the towel. So we did sort of tackle the upper body, the mid back, just by palms up. Now we're going to do wringing out the towel. So you're going to bring that towel out of that low back area that you've positioned it in. You're going to grab it, and you're going to pretend there's like a lot of water and wring like this. And just keep going and slowly come to the middle of your towel. So you're wringing out all that water in there. So as I promised, it was a dual purpose for that towel. Again, wringing it out, feeling really good, and really stretching out those forearms and the wrists. The last stretch we're going to do is we're going to put both hands like this on your head, just gently pressing like you're doing a curl or a sit-up. And what you're going to be doing is using that mid-back, not the low back, and just slightly rotating. And you'll feel that throughout your spine, going the other way. Just be some gentle motions. You don't even need to hold it. Coming forward, bringing yourself down, and then slowly bringing it up. to the sky. And those are the three that would be the best to do. They'll give you a little bit of movement throughout the day. Super easy to do if you can't leave your workstation, but if you can, it's even better. Just keep that variety, keep the change in your work environment, and try to change where you're sitting every so often, whether it's for lunch, after work, so on and so forth. You just want a lot of variety in your environment throughout the day. So last but not least, I want to thank you so much for joining us today. It is again our first webinar of the week. We are doing free webinars every single day this week with different practitioners and different areas of expertise. A lot of you have asked for things like carpal tunnel, information of low back, hip pain during pregnancy or non-pregnant patients as well, and of course the T-Rex syndrome and how to fix your posture. So we're going to be talking a lot about those. You can sign up on our social media just like you did for this webinar, and we really just want to provide you with some information, especially when you're feeling maybe tight and achy and aren't able to see your practitioner as readily. So come take homes. Focus on your 80%. What do you do 80% of your day, and how do you tackle that? Again, if you're sitting at a desk throughout your day, these are perfect things to change, and they're easy to do. If you're on your phone, maybe get a headset, just sort of focus in on what you're doing 80%. Number 2, work on making the 5 changes that we talked about today to prevent future injury. So even if you don't have any aches or pains or you're not feeling it, they sort of creep up over time. So you really want to make those changes today to prevent any future injuries. Number 3, take breaks from long or repetitive tasks. Again, going back to that 20-20-20, walk away from your computer or your setup for 20 seconds, give yourself a nice break, take a walk after work, or even during your lunch break. You can do your Zoom and lunch or Zoom and walk. Number 4, exercise and stay active however you want. Just sort of make it a habit in your day. And number 5, virtual ergonomic assessments. So we are providing virtual ergonomic assessments for any patient. It doesn't have to be someone that we've seen already, but it could be a new patient as well. And those would be specific to your work environment. You can call us to do this. You can also book online. And again, these are all done similar to what we're doing today through Zoom. And we would be touching base with you and sort of looking at what we can do to make changes suitable to your work environment. Because again, we don't know how long we'll be at home for, and we want to make sure that your body is feeling good for the long run. So if you do want to book a virtual appointment with us, we are accepting new patients for chiropractic virtual appointments, physiotherapy virtual appointments, as well as ergonomic assessments. And you can definitely give us a call, like I said, or you can book online on our website at coreorthocare.com. If you have any questions, we are more than happy to answer them. We love talking to our patients. We really miss our patients, and we cannot wait to go back to work, hopefully shortly. And we are seeing urgent care patients for chiropractic as well as physiotherapy. So if you're not sure if you are urgent or classify as urgent, it's people who are in severe pain, people who don't want to go to emerge, people who are taking a lot of Advil and Tylenol and not feeling good. And we're definitely seeing patients with, of course, proper safety protocol in place. We have, again, like I spoke about, upcoming free webinars all week with each of our practitioners. Rebecca Foster is going to be talking about carpal tunnel tomorrow and making sense of wrist pain. And then Wednesday, Eric is going to be speaking about low back pain and how it's a pain in the butt. And you can, again, register online for those using this link here or on our social media, Facebook or Instagram, and through our mailing list as well. Or you can contact us and we can add you to the webinars. We also have 2 more, Thursday and Friday. So here's our contact information. I really hope that this was a helpful webinar for you. If you have any questions or concerns, again, we miss our patients. We would love to speak to you about any of those concerns. And you will be getting this webinar sent to you as a reference within the next day. In case you do want, in case you forget or you you need to reference back to what we've spoken about. I hope you guys have a great day. Again, thank you so much for joining me, and we will talk to you soon. Take care.